brushing away, you're doing everything you know, yet still, or you don't have a gum disease, it could be sign or signal of a medical condition. Common ailments include respiratory tract infections, sinusitis, bronchitis, and diabetes. So these illnesses, I call them dis-ease. We say disease, but I call it dis-ease. Our body is in imbalance. Infection can cause your breath to smell. A bad sinus, persons could say that they can smell their breath. And even diabetes, persons literally tell you sometimes it's as if their mouth always smells so sweet, or tastes so sweet rather. Bad breath may also be a warning sign of liver or kidney problems. How? If there is a lot of toxins in the body, then it is going to give that signal through the kidneys. Vital signs. Look at the word vital and signs. What are you seeing? What are you feeling? What are you hearing? Vital signs. Temperature. You're able to feel and know that, no, this is not the normal temperature of my body. And so you have to go see your doctor or take out your temperature, your thermometer, and check to see if it's over 99 going to 100. You know that you're having a fever. Your body is fighting maybe an infection. Blood pressure. Many persons are not able to use the chart at the top, the stethoscope, to do their own blood pressure. They have to do it by a doctor or a nurse. Or they're not trained how to read the machine. But you know, have the digital ones that you can put on your wrist, or there are many apps that you can now download and you can check. So if you're home alone and you don't feel well, you could quickly go download the app before, test your blood pressure, call your doctor and say, doctor, I did my blood pressure, it's supposed to be 120/80, but it's 190/100. The doctor will say to you, do this, do that. Call your ambulance service, get to the hospital. Even your pulse. You're able to test your pulse. You have pulse points in the neck. You have pulse point in the elbows. I'm not going to use all the medical terms. You have pulse point in the wrists. All these, you're able to tell that something is off because you should be beating at 60 to 100 beats per minute, but you notice you're beating at 40 or you're beating at 120, 140 going up. It means that something is happening to the heart or to the lungs and you need to get to the ER room fast. We look also on respiration. This is, I would like to see if I can show you this. Let me stop share the screen for a bit and do a demonstration. So you're laying down or your family member is laying down and you notice that instead of their chest rising 1, 2, 3, all the way to 16 or to 20, it's going like this. 1, 2, 3, 4, 5. It's going faster than it should. And you should be getting 16 to 20 rise of the chest per minute, but you're getting way more. It means that the person might be having a heart attack or the body is about to, the person might be about to faint or something is off balance. And so these are simple things. I can see clearly now, I was not coming to speak only about the optic system. It's what you're seeing, what you're hearing. But I use this word, I can see clearly now because you will be able to read the screens from your gadgets or the blood pressure monitors. You can see exactly what is happening to you. Let's go back to the slide. All right, let me change this one. Okay, that one froze. Okay, can you see clear now? Okay, it froze again. Hold on, let me try another one. Because I want you to get a practical view as to what I am saying. All right, head to neck assessment. Why should he be stricken anymore? He will revolt more and more. The whole head is sick and the whole heart faint. So can you imagine? God was giving Isaiah instruction, but he was saying the whole head is sick and the whole heart faint. You know, when you have a headache, you can't function. But headaches sometimes are signals to say something is wrong. A headache is not always a message that something is wrong with your head. But because you are fully wired by God, the pain message goes to the brain, but sometimes you're hungry, you need to get some food. So it sends message from the vagus nerve in the stomach to the brain, and then the pain begins to happen. So when you take a pain medication, it only causes the pain receptors to go quiet a bit, and then you find yourself have to take the medication every 4 hours, every 5 hours. The hair. And fear not them which kill the body, but are able to kill the soul, but rather fear them which is able to destroy both soul and body in hell. Are not 2 sparrows sold for farthing, and one of them shall not fall on the ground without your Father? But the very hairs of your head are all numbered. So yes, every hair on our head is numbered. So when you would come for an assessment, the thorough doctors or nurse would check even your hairline or your hair to see if you're having a lot of hair loss, and they would know that this person might be going through a stressful period, because that's one of the signs for hair loss. There are many conditions cause your hair to fall out, but at least they'll be able to find it. So today, I'm not here trying to play the role of your doctor, but I'm trying to do what is known as home care or preventative care, so that you can do things right away and you don't have to be calling the ambulance for everything. Skin, hair, nails issues. Pay close attention to your skin, because your skin is the largest organ of the body. About 18 square feet of skin you have. Yes, it's the largest organ. So pay close attention, because there is discoloration, there are different they call it lesions, but basically whatever you see on your skin like warts or bumps, pay close attention to them. Pay close attention to excess hair loss, to skin temperatures, your nail bed. So let me stop again to do a demo. If you should take your index finger and squeeze the finger and count 3 seconds quickly, 1, 2, 3, and release, then you should see the blood returning right back to the end of the nail bed. It's called capillary refill. Now, a thorough doctor, when you go for full assessment, would take your fingers and do the capillary refill on each. Why? They are checking to see how quick the blood return to the area, to ensure that you're not having a blood circulation issue and that the tissue is being oxygenated quickly. As simple as your fingernail. It's like an X-ray machine. And so you have what is known as peripheral disease, which are circulatory issues to your hands and your feet. And so they're able to use this to tell if circulation is going fast enough to this area. We are fearfully and wonderfully made. Okay, I guess we have to do it back over each time. It's not allowing us to continue the slide. All right. So for us, we could go out and we could buy ourselves a thermometer. Some persons read theirs in Celsius, others in Fahrenheit. But you see the scale on the right side to tell you the normal body temperature is 98.7 on the Fahrenheit scale. All right? So we're not going to get all technical. We just want to do some quick home care. All right? What is the color of your urine? The urine may also appear darker when there is bleeding into the urine, and the numerous causes of bloody urine are infections, stones, cancer, trauma, kidney disease. They can all contribute to a darker appearance of the urine. In the presence of a urinary tract infection, the urine will appear cloudy or darker. So, for the wives that are on this presentation today, I have two pipe tops, you would call it, or in Jamaica we'll say pipes. I have two pipe tops. One is showing the pressure of the pipe coming out very forceful, and one is just trickling. I can see clearly now, but I want you to use your hearing, your sense of hearing. If you go to the bathroom and you know that you normally have a full release of urine and you have drank enough water, 8 glasses of water for the day, but yet still all you're doing is trickling on the right, it means that you need to seek medical attention, because it's either that there's a blockage or that the kidneys are not functioning properly. So I say this to wives. This is one of the signals that you can use to know that if your husband goes to the bathroom, when many of you have your bathroom in your master bedroom, so you can hear, start paying close attention, because it can take time after time until it becomes a major problem. Look and live. We won't get into all the medical terms. I just want to keep it simple. But a pale color urine, straw-like we would say in nursing school, means that the urine is healthy or hydrated. Bright yellow, you may have taken a lot of vitamins, and that's the color. Red, it could be blood in the urine, or you may have had too much beets or blackberries. Orange urine, you might be dehydrated. Certain drugs and medications, I would say that our blood, we need to be cleansed, or our urine, we have ate too much of certain type of food, and that's why I always say our urine is highly concentrated. Purple is a metabolic disorder. So we know that our body's metabolism is able to break down the carbohydrate that we eat, and sometimes if the body is not able to, then purple urine can come, which is very rare. Maybe nobody has ever really seen that in their own family, but it can happen. Then you have brown urine, where certain antibiotics can cause your urine to become brown. And then green, drugs can cause it, or certain dyes in food. So you eat a lot of lollipop, or sometimes you drink a lot of green juice, your urine can change because of what the body was not able to digest. I can see clearly now. We now go to the reproductive system, because we're looking at the physical health. So take it for granted you went for a full physical, and yes, the doctor has to check everything. Or you see your gynecologist this month, and then you go to your general practitioner. Warning signs that your vagina is unhealthy. Yes, they talk about that in church. Yes, because persons can be so uncomfortable and they don't want to come to church because they feel as if something is going off, and they don't want to feel uncomfortable around people. Laugh a bit if you wish. But from Top 10 Home Remedies, one of my favorite sites, it is unlikely for your vagina to smell like a bed of roses. But if you notice a recurrent strong odor, one that even transfers to your undergarment, it might be a sign of an infection. A constant itching and burning sensation indicates the onset of a number of vaginal infections. Itching is a sign something is off. Abnormal bleeding, what are you seeing? Our topic today, I can see clearly now. This was inspired by the Holy Spirit to do a teaching like this in this form, that you will take note of what you're seeing coming from your body or what is on your body. Your vagina becomes dry, thin, and inflamed when your body produces less estrogen for those who are going through menopause or about to go through menopause. So the body produces less estrogen than is required. Estrogen also helps with bone health for women. So most times you think it's arthritis, but sometimes your estrogen level have been depleted. So when there is dryness or inflamed, it is called vaginal atrophy. The most common symptoms of vaginal atrophy is a painful intercourse because the muscles of the vagina is not the same as before. And so many persons don't want to talk about it, but if the church is going into a different season, then we have to speak and to allow persons to realize that there is help. Don't keep it to yourself. Message from the saliva. Your saliva lets you know the level of mineral reserves available to your body. Remember, our bodies are constantly trying to rid themselves of excess acids created by our cells doing their daily jobs. We can overwhelm the process by eating poorly and getting little or no exercise, which creates more acids in the body. So the chart might not be clear to many of you because it's pretty fine, but I'll read it for you. You would go to the store and buy over the counter what is known as a universal pH test strip, which you're able to use your saliva or your urine to test the level of your pH, which is how your body is dealing with the excess acid or if it is alkaline. So we have pH, which is 0. That's what a battery acid would be like. Stomach acid is normally pH 1, vinegar 2, orange comes with 3, tomatoes 4, black coffee 5, our saliva and cow's milk normally a pH at 6, but pure water, seawater, has alkaline levels of 7 and 8. So the pH means the alkaline level in the water. So we often go to the stores and we quickly go on the shelf, and because they tell us that this brand water has pH 9, you must test your water, because sometimes by the time the water reaches to you, all of that is gone. So do not only buy a brand, but test to make sure it is so, because your body can go into metabolic acidosis when there is too much acid in the body. So we see that it is in the, I'm going to focus on the alkaline side, that the fruits, vegetables on the right side, those are the food that carry a lot of alkaline. And then you can, I don't want to call any water name, but you can go to your store, pull a bottle and test the water for yourself to make sure that what they brand is what is in the water. So a lot of fast food, fries and burgers, those foods are often acidic, and even carbonated drinks. Common digestive problems: eating too much processed food or junk food, high salt or sugar intake, not eating enough fiber from fruits and vegetables, eating large portions in one sitting. We must try to eat small portions often so we give the body enough time to digest the food. Poor eating habits, like eating too quickly or skipping meals, will affect the digestive system. Remember now, the digestive system is from the mouth to the anus. And remember now, your large intestine is 8 feet long. It's just coiled on the inside. And so if you're not eating properly, if you're not drinking enough water when you should, then you're causing waste to build up. And that can be toxic, and headaches and all different illnesses can come because the feces that should be exiting is being stored up to the walls of the large intestine. Neurological assessment. There are some big words on screen. Olfactory nerve. How to test if everything is okay with my olfactory nerve. What's that? I am so glad you asked. Olfactory nerve basically means the ability to smell. Did you know there are many patients that I would have seen who lost their sense of smell through sinus issues and other neurological issues? And so when we are doing health assessment, we'd normally bring vanilla, a nice flavor, or coffee, and we're able to allow them to test to see what they're smelling. Otherwise, if the person is blind and cannot smell, they might take up the wrong bottle and they might end up drinking, and you know what can happen. So that's how important it is for our olfactory nerve to be working. Remember now, persons have their elderly parents, persons have parents who are elderly, yes, and living alone. So we need to do some simple things to see if mom and dad is okay. The optic nerve. Many of us would know about the optician or the ophthalmologist. But this is what the doctors would do, is to check to see that your optic nerve, not just to read A, B, C, call the C, D, or call the C, O because of what you're seeing, but the optic nerve is more than just reading the chart. It is able to tell many other medical disorders that might be happening. Some persons might be having night blindness, so they have to get a different type of prescription glass. Some persons might have burning in their eyes whenever they go on the computer. They might have to get the glass with the blue lights. Different things can happen. So we are testing all of these things in our life. What if the person is not able to speak, but we're able to understand from their sensory nerve? We use cotton in our assessment, or a sharp object or a dull object, and they're able to shake their head if they can't speak to say that they can feel, I can feel. These are important. Why? For those with diabetes, after a while, as the body ages, then you can go into stages where you lost this sense to feel, and so you can step on a sharp object, don't know, and only to know that a couple days later you're seeing this bump or you're seeing this swelling because it might not have bled, so you did not know you got a cut. So these are things that we need to pay attention to. As a church, we can do our own assessment and to help our family as we go. Somebody sent a message? Okay, yes, I got a message that persons who came down with the virus also lost their sense of smell. So we understand that with all this mucus building up in the stomach area, oxygen level is depleting, circulation is depleting, because we got a report out of Italy that when they did the autopsy on several hundred people, they all had a blood clot with the disorder. So can you imagine? They could not breathe. All eyes will now be on you. Turn your eyes on yourself, or turn your eyes on your husband, your wife, your children. Sometimes I'm sitting and I'm looking on my husband, and he said, "What you looking on?" Because I'm sitting there and I'm doing my own assessment. Because of his such quiet personality, I guess he has a high threshold for pain, so he will not express that he's having pain, but I will observe. Or the Lord might give you a word of knowledge to say, tell him to do this, tell him to do that. Sometimes, as husbands or wives, we delay our own process because we might not do the things that we should do, and nothing happens overnight. So sometimes we can also have what is known as self-invited issues. We were supposed to drink the water. We did not drink. I'm going to drink some water right now. We did not drink the water when we should. The body went into dehydration. The body went into metabolic acidosis. The body went into all different things. And yes, it affected the organs of the body. Because remember, we are about 70 to 75% water that is in our blood. And the Bible declares that the life of the flesh is in the blood. Before I get to this screen, let me do an illustration. Yesterday we talked about being spirit. Let me turn it to the camera. We are spirit, we are soul, but they are all hosts in the body. So we are body, soul, and spirit. So yes, we can be so spiritual, but then we find out that sickness and disease still affect the body. Because remember now, this body is able to decay. So sickness and disease can come. Remember now that he said we shall be changed from mortal to immortality. So different things come on the body. And that's why it is very important for us every now and then to find ourselves at a lab. If we don't have a doctor's appointment, we can walk into the labs, because there are labs around that you tell them exactly what test you would like, and they're able to do the test from the panel, because the life of the flesh is in the blood, and so your blood is speaking. What is your blood saying about you today? From time to time, I just walk into a clinic and I just ask them I would like to see this or I'd like to see that. I'm glad that you understand your body. When you understand your body, you're able to go in and ask them for a particular test. Even before I got this level of knowledge, I did not allow the doctors to dictate to me, because remember, more than one illness have the same symptoms. Remember that. More than one illness carry the same symptom. So many persons were misdiagnosed and more lives could have been saved, but they were focusing on the oxygen level of the patient when the patient needed an aspirin or warfarin or heparin to thin the blood so that the blood could return through the pulmonary system or the lung system to get back to the heart to oxygenate the body. So many persons were misdiagnosed and many deaths happened. But what if they knew? But many other persons, on the other hand, they knew about garlic, because garlic has components of blood thinning, and that's why they'll tell you if you're taking warfarin or heparin, you would not take garlic. You'll see that on your prescription. Do not digest garlic at this time. So what did the people in olden days use when there was no medical office, no Orlando Health? What did they use? The Bible declared that the herbs are for the healing of the nation. And while I'm not promoting no form of health product here, but through my time over the last 20 years, I have had the opportunity to see persons going on natural supplements, and I've seen their medical reports change. So there are things in place. Sometimes things are too far gone. For example, if there's a tumor, you might not know a tumor is growing until it reached too far. So you can't really blame the person. You did know the tumor was there. There are many persons who did not feel any pain. And I can tell you that from being a reflexology practitioner, I would assess the patient's feet, because every nerve connects to the bottom of the feet. And we'd assess the nerve pathways, and we'd get feedback like lumps or hard air or rock. It gives wonders to doctors as they watch this practice being done. And I'll answer that question. The lab which allow you not to use any doctor's paperwork is called Any Lab. It's on Good Homes Road for those who are in Orlando, beside Publix. You can just walk in and do a medical. That's one of the labs that you can use. I saw the question pop up. Okay, so let me get back to assessing the very feet. Your feet tell a lot about your body. I can look at your feet and tell that you're stressed, because under your small toe, you're scrubbing away and it's not callous. You're so stressed and you're feeling it in your shoulder, and the shoulder is sending the signal to your feet. I've written a book, The Study of Reflexology Throughout the Caribbean, as I traveled on mission trips and I serve in different clinics. And if 100 persons came with that particular sign, they had basically the same story of being stressed. Respiratory issues. Even as many of you know that my husband did surgery. It was from an assessment of his kidneys. I felt a hard lump at the bottom of the feet. But based on my over 13 years of practice, I knew that that connects to the kidney system. I said to the doctor who I practiced along with, could you write up some documents for me so that he will be able to get a full check on his kidneys, because the doctor just gave him some pain medication and sent him home. And I insisted based on my assessment, and that's how they did the blood works and recognized that though he was a water drinker, he doesn't take a lot of salt or sugar. He maintained his body weight for years. Everybody asks how he do it. Yet still, he ended up in a renal clinic because they say that his body was toxic because the kidneys was not functioning as it should. But yet, all the things he should have done for a healthy kidney, that was his lifestyle. If you should come to our home while we're in the BVI, we never ate a meal without salads or fruits being on our plate. If we didn't have it with the meal, we had it on the side. We did not go shopping without the cart having more fruits and vegetables, less meat and starch. That was our lifestyle when it happened. So yes, you can be eating healthy, you can be a vegetarian, and yet still things happen. So you might not see a lump, but then the Lord gives gifts. When I got the opportunity to do this study, reflexology, I said, God, what's that? It was a word of knowledge I actually got. And I went and I told a friend, and she said there was a school. But the Lord said to me when I was finished and certified, now go and read Luke 7:37-38. When I read it, I got the exact passage of scripture. It showed of the woman who anointed Jesus' feet with the alabaster box of oil. Why? He was saying to me, as I studied in further medical books, she was known as the first medical reflexologist. Reflexology work. You're able to assess persons. Many persons in the Middle East or in Eastern medicine did not have a hospital to go to, but they were able to assess, and then they were able, based on their study, to know that this particular herb is for the lung. While I'm not promoting herbs, let me put that up, but the Lord said that the herbs are for the healing of the nation. So they were able to use the different oils, because every oil from the plants, the eucalyptus, the orange, the lemon oil, all these are able to help some system. When it goes to the olfactory nerve, you smell, message goes to the brain, and it changes emotion. Because the same area in the brain that focus on emotions also focus on your sense to smell, how unique it is for us. So yes, you can do these things. As I said before, I am not your doctor, but because of the current shutdown, there are things that you can do to check your own body to know exactly what is happening. We will not go into all the medical range, what it should be looking like, but just to say, these are the things that we must be doing. All right, I'm going to go to the slide, and we're going to look on some quotes as it relates to seeing clearly. Charlotte said, the soul fortunately has an interpreter, often unconscious, but still a faithful interpreter in the eyes, or in the eye. Samuel said, where words are often restrained, the eyes often take a great deal. So there are persons who, they don't talk a lot, but you can look when they are before you, and you can tell that they are stressed, they are carrying a heavy load, but until they are free to open, sometimes you have to leave them, because persons are not able to be helped until you're ready for the help. Even learning, you have to be ready to learn. One of the laws of learning, the student must be ready. Let my soul smile through my heart, and my heart smile through my eyes, that I may scatter rich smiles in sad hearts. Look at that. So we are going to wrap up now, but the real voyage of discovery consists not in seeking a new landscape, but in having new eyes. Let's start to look at things different. As I close, we are going to look on this last slide. Look back. You are not Lot's wife. Many persons, when they go to stool, they don't look back. But chances are, if you look back, you'd have known that there is blood in your stool or that your bowels are fragmented. On the left, you see what a healthy stool looks like a sausage. The one on top, it shows the shape of the colon, those pockets. Sometimes when there's not enough water, it comes like a pebble. I say to you today, look back. You are not Lot's wife. Thank you very much for being in this Zoom room today. Any comments?